Welcome to our new video First Aid MCQs. What is the primary aim of first aid? Diagnose the condition, provide temporary relief until professional help arrives, cover the patient completely, perform surgery if needed. The correct answer is option B, provide temporary relief until professional help arrives. When treating a nosebleed, you should not pinch the nose, tilt the head backward, lean forward, apply a cold compress. The correct answer is option B, tilt the head backward. What should you use to treat a bee sting? Baking soda paste, cold compress, vinegar, antiseptic spray. The correct answer is option A, baking soda paste. When treating a person who is unresponsive and not breathing, what is your priority? Check for a pulse, call for emergency services, begin chest compressions, shake the person. The correct answer is option C, begin chest compressions. What is the recommended duration for washing your hands to reduce infection risk in first aid? 10 seconds, 15 seconds, 20 seconds, 30 seconds. The correct answer is option C, 20 seconds. What should you do first if you suspect someone is having a stroke? Help them lie down flat, check the fast signs, give them aspirin, perform CPR. The correct answer is option B, check the fast signs. What is the first tip when you approach a person who appears unconscious? Check for injuries, call for help, check for a response, start CPR. The correct answer is option C, check for a response. If someone suffers a suspected spinal injury, what should you do? Roll them onto their side, keep them still and support their head and neck, sit them upright to relieve pressure, move them to a softer surface. The correct answer is option B, keep them still and support their head and neck. What should you do if someone suffers a second-degree burn? Cover the wound with a clean non-stick dressing, pop the blister to reduce swelling, apply butter or oil, expose the burn to direct sunlight. The correct answer is option A, cover the burn with a clean non-stick dressing. What is the first step in treating a suspected heart attack? Start CPR, give aspirin, apply cold compresses, make them lie down and raise their feet. The correct answer is option B, give aspirin if not allergic. You see a cyclist fall and suspected a spinal injury, what should you do first? Remove their helmet to assess the injury, call emergency services and stabilize their head and neck, move them to a safe location, perform CPR. The correct answer is option B, call emergency services and stabilize their head and neck. You are hiking when your friend twists their ankle and cannot walk. What is your best course of action? Apply a cold compress and bandage the ankle, help them walk slowly, massage the ankle, ignore it and keep moving. The correct answer is option A, apply a cold compress and bandage the ankle. What is the recommended position for someone experiencing shock? Sitting upright, lying flat with legs elevated, on their side in the recovery position, standing and leaning forward. The correct answer is option B, lying flat with legs elevated. What is the universal sign for choking? Clutching the chest, pointing to the throat, hands around the neck, gasping for air. The correct answer is option C, hands around the neck. What should you do first if a person is bleeding severely? Apply a tourniquet, apply direct pressure to the wound, elevate the injured limb, call an ambulance. The correct answer is option B, apply direct pressure to the wound. What is the best way to assist someone having an asthma attack? Encourage them to breathe rapidly, help them use their prescribed inhaler, lie them flat on their back, give them water to drink. The correct answer is option B, help them use their prescribed inhaler. A swimmer is pulled from the water and is not breathing. What should you do first? Check for a pulse, begin rescue breaths and chest compressions, place them in the recovery position, dry them off completely. The correct answer is option B, begin rescue breaths and chest compressions. You witness a car crash and someone is bleeding from their leg due to a deep cut. What is your immediate response? Apply direct pressure to the wound and elevate the leg if possible. Apply a tourniquet above the wound. Cover the wound loosely with a bandage. Wait for emergency services without intervention. The correct answer is option A. Apply direct pressure to the wound and elevate the leg if possible. Thanks for watching. Subscribe MCQs 1 for latest informative MCQs.